Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Hi, and welcome to Plasticos. It's the podcast where you get all your questions answered about plastic surgery, anything you wanted to know. I'm Kym Anderson, joined here with Dr. Christopher Park, board-certified plastic surgeon here in Mobile, Alabama. Now, let's talk about 3 procedures that we can do to help us look younger, because that's what everybody wants to do. We want to hold on to that fountain of youth.
You know, there's so many things I do, hundreds and hundreds and hundreds of different procedures. But yeah, if you want to talk about 3 ways to kind of do something that's easy and straightforward and going to really help you look younger, I'd probably focus on injectables.
Okay.
And the eye area and the lip area. Because, of course, I'm thinking of things you can see. I'm not talking about breast and body and those sorts of things. So if you're even talking to a younger patient that just wants to kind of look as good as they can, those are kind of the 3 things. So we can kind of go into each of those. But when I talk about injectables include both fillers and neurotoxins. And we're going to use those to reshape and smooth out the face. And those are done in the office. Some risk of bruising, very slight with neurotoxins. It's a tiny, tiny, tiny needle. And a little bit of a risk with the filler, but it's just a bruise. And we can do those in the office. And you are wide awake. We can do some nitrous oxide sedation if you need that to take the edge off. And we do numbing cream. And those are just, come in, talk to me, we'll make a decision, we'll make an assessment, and we can do it that day. If you want to switch to the lips, lips are a very common thing now. And your lips really can aid you when they are thin on their own accord or when they start to wrinkle. And we have these amazing fillers now that can help with that. I love the hyaluronic acids. They are a natural substance and they're very safe, and we can use those to plump up the lip. You know, I don't like massive, huge, artificial looking lips. So most of the patients I've done, you've talked to them and had no idea. I mean, we were trying to just smooth things out. I mean, some women do not have a well-defined vermilion. A vermilion is where the lip meets the skin. It's that edge. If you fill that in, it just makes the lip prettier, not even larger, just prettier. And when you do that, it does add some volume, so it stretches things out a little bit and helps with some of the wrinkles. Occasionally, you know, when patients get older, we may have to start doing some of the vertical lip lines. Some people call them smoker's lines. You don't have to have smoked. And yes, nicotine makes you age faster, but it's also the act of having your lips pursed around the cigarette. You know, just like somebody that uses a straw a lot, it's going to happen more. All that is happening with the vertical lip lines is that muscle is a circular muscle. It's a sphincter. So when that muscle contracts, it closes up kind of like an accordion. And when your skin is thick, you don't see it. As your skin thins, you can start to see it. So we need to kind of add some volume to kind of smooth that out. Now, we do have little minor surgical procedures that I love for lips. Now, they're not for everybody, but a lot of times when I mention these to people, they had no idea, and they're really fun procedures. And so the 2 most common ones are the subnasally lip lift, and that means under the nose excision of a 4 to 9 millimeters of skin, and that pulls the lip up with an incision underneath the nose where the nose meets the lip, which is essentially an invisible location to have a scar. Okay. And it really can enhance the face. And whenever I look at somebody, you want to be able to see a few millimeters of your upper teeth. And if you can't, nobody can see your upper teeth, whether you were just born that way or you're starting to age, it makes our brain think that you are older if you cannot see teeth. I mean, you even go so far as sometimes thinking, do they have teeth or do they have dentures? I can't tell what's going on. In that procedure, yes, it's a slightly bit of a tender area, but that is a minor procedure. It can be done in the office, local anesthesia, no surgery. And we just do that. Now, it doesn't lift the corner of the mouth. So a lot of times I'll combine that with a corner of the mouth lift, which is also something that can be done with local anesthesia. And we can extend that and get essentially the whole lip to lift up if it's a thin lip. Other things we do around the mouth, lasers can help with those wrinkles and helping in the skin to tighten. We can do facials, we can do peels. And also around the mouth, sometimes we will do actually a lip implant. If somebody doesn't want to have fillers, which usually last about a year, there are silicone implants and Teflon implants. We can use a permanent implant in the lip. We don't do that as much now that we have these awesome fillers, but that is an option.
Would they have to worry about losing sensation or filling in their lips when you have an implant?
No, it's essentially the same shape as what we're trying to achieve with that vermilion injection. So it just slips right along that edge where the mucosa meets the skin. So no, the nerves are fine.
Now, I mean, what are some other things? Because I guess you think about, the crow's feet and bags and droopy eyes.
Yep, the eyes are the wind of the soul, and there's a lot of things we can do to rejuvenate that periorbital area, which is the area around the eyes. that are not that involved. Upper eyelid surgery, very simple, very straightforward. I've done it under local anesthesia. It's not really what I would recommend. It's nice to have some sedation and do it in the operating room, but it's a very simple procedure. It's really not involved. It's not something you need to dread or worry about. So that is simple and easy, and that's surgery. And then lower eyelid's a little bit more complicated. There's a lot more physics going on, and you have to get things to line up right. And even when we do things right, a lot of people complain of itchy and dry eyes and those sorts of things for a little while after the lower lid. So I just talk to people a little bit more before we commit to that. But if you have bags, or festoons is another term for it, that we can make a dramatic difference in the eyes. And this is not always, I am old, I need my eyes done. I mean, I've done eyes on 20-year-olds that just, have those bags that just, in the tear trough. So I call the divot that can kind of occur between the nose and the eyes is the tear trough. If you cry, that's where the tears are going to run. Some people just have that at an early age.
Is it like fat that accumulates there, or what is it?
So it's actually a lack of fat. So it's the combination of having a hollow area and then bulging bags, which is there's 3 compartments in the lower eyelid of fat. They are there designed to be pads for our eyeball if it gets trauma. If you get a punch to the face or a baseball to the face, that fat is there as to keep the eyeball from getting hurt. But it's held in by a very thin layer that we call the septum. And if that septum bulges or gives a little bit, then it starts to bulge out. So when you get that discrepancy between the bulging lower eyelid and then the thin bone and the tear trough, it can make you look very aged. We can hide it either by putting a little bit of filler along the bone in the tear trough or doing the surgery to remove some of the extra fat in the lower lids. And then that's all the surgery. I mean, and even those aren't that big of a deal to undergo or painful or much recovery. Then we have all these things that are non-surgical. I mean, crow's feet, the best thing you can do is a neurotoxin. Everybody knows the word Botox, but there's other ones, Dysport and Xeomin, and there's new ones coming out. Even if you have your eyelids, you still, crow's feet require a neurotoxin to help treat it. It's the same thing we talked about with the mouth, which is it is a sphincter. It is a circular-shaped muscle, and it's continuous. And that muscle is there to help us close our eyes. When those muscles tighten, it makes the accordion look, which is your crow's feet, and you can relax those outer portion of that muscle and not affect the eye function at all. In actuality, that sphincter of the muscle starts at the eyebrow and goes to the eyelid. So it actually pulls the eyebrow down, that muscle. Okay. So when we relax that muscle with a little bit of neurotoxin, the eyebrow actually goes up a little bit. So I love treating crow's feet with neurotoxin. It really opens the eyes and smooths things out.
Now, I can take anesthesia and everything else, but I'm always a little fearful of needles. So for those of us like that, I mean, you're talking about it's not really painful.
It's not. I mean, neurotoxin it's the smallest needle manufactured that we use to inject neurotoxin. We are putting in tiny, tiny amounts. It is a needle, but it's smaller than an insulin needle. And you're just sliding it in, and it's a liquid, and it spreads out a little bit, and it smooths things out. Filler, we have to use a little bit larger needle just because it's a thicker substance. But yes, neurotoxin, and we use numbing cream, and it's really nothing to be fretful of. I did, recently, a year or 2 years ago, I started having something called Pronox, which is nitrous oxide in a patient-controlled manner that you can use, which is like laughing gas at the dentist. Okay. Mm-hmm. And just to take the edge off if you are a fretful type of person. It's completely safe. It's not being put to sleep. It's nothing you need to worry about. But yes, if I get a nervous patient, we're happy to do that. That's why we got it.
So there's other procedures. I mean, you were talking about for the 3 that we have, we've got our lips, of course, that make us age, or our eyes that make us age. I mean, what are some of the wrinkles in our forehead or something like that? Also
addressed best with neurotoxin. So the main areas we use neurotoxin is around the mouth and then between the eyes, the forehead, and the crow's feet. There are other places, that's kind of neurotoxin 501 level class, but those are the common areas. And those are best addressed by relaxing the muscle causing the wrinkle, not trying to chase it with a filler and fill in the wrinkle. And we talked about it a little bit with the eyes, and I'd like to get in with the forehead because patients, I feel like they've never heard it when I say it to them. But there are 3 muscles between the eyebrows. Mm-hmm. There's the procerus and the corrugator, and they pull down on your eyebrow, okay? And they pull down on your forehead. And they are what people call the 11s. They're the wrinkles you can get that are vertically oriented between your eyebrows. Those muscles, we do not need one little tiny, tiny bit. And when I do a brow lift, I pretty much take all of them out, okay? Oh. But because we don't need them, they're awesome muscles to treat with neurotoxin. Again, we don't want to paralyze muscles that we need, but the ones we don't need. You also have to take the explanation a little bit further. So if we relax those muscles that are pulling your forehead down, now your frontalis muscle, which is the whole muscle of your entire forehead, basically the size of the palm of your hand, is unopposed. Its job is to pull the eyebrows up. So if you relax the ones pulling the eyebrow down, the one pulling up smooths things out. It's not fighting anymore, so it doesn't have the wrinkles as much, and your eyebrows move north. They move up. So it's not just relaxing the wrinkle. Your eyebrows actually go up. Now, once the wrinkles get a little bit more severe, we a lot of times have to start weakening the frontalis, which is the muscle in the forehead. We want to do just the amount we need to relax things, and that way you still have full motion of your forehead. I mean, you can still raise your eyebrows and expression and those sorts of things. There are certain people out there that like the completely paralyzed forehead. It's not my taste. If I have certain patients that want it, we talk extensively, and I have done it. But I like people to still be able to move and animate. Yes, it gets smooth, but if you can't move, it's a little bit odd to me.
Yes.
So that is not my goal. And when I say I'm going to inject your forehead, that is not what I'm saying. But sometimes we are going to weaken that frontalis muscle to where it still moves, but it's not quite as strong to smooth things out. And neurotoxin is one of those things to me. I start with as little as I think I can, and I have somebody come back 2 weeks later, because it takes about a week to start working, and we'll add some here and there. And then once we have you figured out, we document exactly where we put this stuff, then you can kind of just keep coming back, and we know what we need to do next time. And every few years we may have to add an extra bit because you're older. And I really like to treat people repetitively rather than just once.
That's what I was going to ask you. Once you get this procedure done, because some people think that, okay, you know what, I can go and I get Botox, get a couple treatments, and I don't have to do it again for the rest of my life.
No, definitely neurotoxin is temporary. They're working on developing longer ones. There's one coming out now that's supposed to last 6 months, but they really only last about 3 months. They are awesome, but they are temporary. But it's worth it, in my opinion, because I really do think you're preventing and limiting aging. You're not only getting benefit for those 3 months. I think that if you do Botox and whatever neurotoxin you're going to use, you are going to need a brow lift later. You're going to need an eye lift later. So you are doing yourself a big favor. Now,
can you get package deals to where you're going to come back? So let me just buy this ahead of time.
And you bring up a good point I actually kind of wanted to mention. Neurotoxin is not a rarity anymore. I mean, there's lots of places to get it, and it doesn't have to be your plastic surgeon or your dermatologist. And there's other people. Dentists are doing it. Some primary care doctors are doing it. So it is almost becoming a commodity where people like to kind of just shop around and go wherever it's cheapest, which obviously the problem there is you're letting different people do it, and but you're also missing what I just said. I like to figure a patient out. If I figured Jane Doe came in and we did 4 units here and 7 here and 13 here, and she came back 2 weeks later and I needed to add 2 more units there, then I know exactly what I need the next time.
Exactly.
And that's how I like to do it.
And that makes more sense to me, because you want to stick with a doctor who knows exactly your dosage and how much you need, so you don't end up over-animated.
Correct.
Or under-animated. Anything else you want to ask about quick fixes, or should we even call them quick fixes to make us look younger?
Well, I mean, those are things that to me are all very simple, minimal downtime. The only other things to think about with that, which we've hinted at in other shows, is taking care of your skin, both sun protection, but also treatment. So, skin care, and then mixing in lasers. Lasers are a big, broad term, but they are good at maintaining what we need, and we have a variety of lasers that we tailor. I mean, if there's early wrinkles, we can treat that. If there's early blood vessels, we can treat that. If there's early dark spots, we can treat that. And it, just like I've said with facial rejuvenation, it is much better to improve and maintain than let it get bad and try to dig out the weeds.
Yeah. All right. Now, for other people who may have questions, what's the best way to get in touch with you?
Just give us a call at 251-340-6600 or email us at info@mprsd.com or visit the website at mprsd.com.
Dr. Christopher Park, thank you again.
Thank you. Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.